The health department says the rising COVID-19 cases could be addressed in many ways other than imposing a stricter lockdown. Based on the agency's data, the previous 300 to 400 infections per day across NCR went up to about 1,000, while the previous 1,100 to 1,200 daily cases in the whole country increased to up to 2,400 last week. According to the OCTA Research team, the COVID-19 reproduction rate in NCR is at 1.66 and 1.4 across the country. The figure refers to the number of individuals getting infected from a known positive case. If this continues or goes higher, the average number of daily new cases in NCR may reach 3,000 by the end of the month, while the whole country, meanwhile, may see a 5,000 to 6,000 daily spike in infections. OCTA attributes this to the new variants, which also caused a faster surge than what we experienced from July to August in 2020.
Last year, the reproduction number increased to around 1.8 yung highest. It peaked at around that time, but it took a while before it got to 1.8. So kumaga ngayon, it's faster.
For public health advocate Dr. Anthony Liachon, this scenario may be interpreted as the start of the second wave of cases.
We have been stable since November. Even with the threat of the holiday season, the Nazareno, and even with the Chinese New Year and the Valentine's Day, nakita natin na hindi naman nag-increase talaga yung cases. Pero makikita natin in the graph, in the COVID tracker, nag-increase talaga March 1.
With this, both Liachon and David suggest that the government should revisit our current restrictions.
We should not be slow to pull the trigger na kung kailan nating ibalik yung ibang restrictions natin.
But for Health Undersecretary Maria Rosario Vergere, the variants are possibly not the sole driver of the increase in cases. Vergere also maintains that there's no need for a general lockdown.
Alam po natin na ang stricter lockdowns or region-wide lockdowns are really not the only measures for us to prevent the further transmission of this disease.
Meanwhile, medical facilities in Metro Manila are gearing up just in case the upward COVID-19 trend continues. The Philippine General Hospital, for one, has reopened previous wards and added more personnel.
We are recalling some of our healthcare workers who were previously assigned COVID and then were pulled out already.
The PGH has seen an increase in admissions from around 72 weeks ago to 102 patients as of Monday morning. For News 5, Greg Gregorio, we are One News.